All right, let's talk tongue ties. Now, it's a controversial topic. It's controversial in the fact that does it actually exist? And should it be released if it does? So it's really, really hard to even diagnose a tongue tie because there can be obvious ones where it's tied to the tip, and then there can be ones where it's actually restricted within the tongue itself. So it's not noticeable, despite the fact that somebody can stick it out, move it all around, fold it, curl it, all those things. Bend it. Lots of cool things that the tongue could do with or without a tongue tie. So what really matters is, how is your tongue affecting your entire life? Look at the symptoms. Do you have any of those signs and symptoms that are posted on my page? Does your child have those? The sooner we can address these problems, the better quality of life that you'll have. And I don't care if you're 70 years old. If you only plan to live till you're 71, fine. Maybe this isn't the right place for you. However, even if you're 70 years old and you plan to live to 90, 100, well, you want to live your best life. So this could be the step that could push you over the edge so you can look, feel, think, and perform better. So let's do a fun exercise together. Put your answers in a little form attached to my website. Send it off to me if you want to know what I could do to help you, or maybe what resources that you could use just to make that little shift. So again, you can start feeling better every single day. Okay, let's self-assess. First of all, right now, when you're looking at this video, what are your lips doing? Are they closed entirely? Are they partially open? Or is your mouth open and you're focused and concentrating? Okay, jot that down. Next thing I want you to do, take a swallow, rest. Okay, now, where does your tongue live? Is your tongue relaxed on the floor of your mouth? Is it midline, maybe even protruding a little bit between the teeth? Is it the tip of the tongue touching the roof of your mouth? Open or closed, doesn't matter. Or is the whole tongue up against the roof of your mouth? Okay, so third exercise to assess. This is going to be range of motion from the tip of your tongue. So open, what you'll do is you open as wide as you can, and then you'll take the tip of the tongue and you'll put it up on the roof of the mouth behind the front teeth. You're going to assess, does your mouth close partially or close a lot? Mine barely closed. Doesn't mean I have a tongue tie or not. It's just range of motion. It's just finding out where you are. The next thing we're going to do is we're going to do open wide, but then you're going to take your tongue and you're going to suction it to the roof of your mouth. So up there on the roof of the mouth between your top teeth. And then you'll determine, okay, well, what is my widest opening when my tongue is up there versus wide open? So do you have a slight decrease in range of motion or an extreme change in range of motion? So jot that down for me, send it my way. Let's connect for 15 minutes. Let's see if I can help improve your quality of life, whether that's through myofunctional therapy, some health coaching, or just sending you resources to do a few breathing exercises. And I just want to be involved in your journey so that way you can look, feel, think, and perform better.